All right, well, thank you, Andrea and Sinclair, for having me today. I'm very excited. Today I get to talk about Energet. It's something that's been really fun in my practice. It's something that's kind of transformed the way that I treat many patients, increasing both the ease of treating patients. So my name is Dr. Eric Carniol. I'm a double board certified facial plastic surgeon. I operate and practice in northern New Jersey. So I see everyone who's coming out west from the city, and I've been blessed to have a nice growing practice, and so Sinclair and Energet have been a nice thing for me. So today we'll talk about what is the Energet device, how it works, some of the applications. Some of the applications definitely are expanding in my practice, which is just wonderful. So we'll go over some of the ones that I'm willing to share today. We'll talk about recovery, and we'll talk about some case studies as well. Why we love it in the practice, and feel free to stop me if we want to go over various things or grab me later if I skip over things. So what is it? The Energet is a pneumatic device. It's a high velocity injection treatment. The beautiful thing is this is a needle-free injection in which we're delivering materials at 1/5 of a millimeter, so 200 micrometers wide, 1/5 of a millimeter at 150 meters per second. So it is, you're literally getting like a paintball gun speed, very quick, very fast, and getting wonderful drug delivery into the system. And I say drug delivery with flexibility because it's not always active medications, as we'll go over. So it goes right through the skin and literally raises a mosquito bite. It raises that bleb. It's that TB test that we all hate to have for our hospitals. And so what happens is once that tissue hits through the skin, there's a ballistic effect. It literally starts to explode out in various directions. And so you get to watch the skin tethers loosen. You get to watch it instantly soften, which is just wonderful. So here in the bottom right, you can see those really nice mosquito bite blebs that are going in. This was for kinetic lift. And so it's a very controlled depth. So here we're able to change the pressure and the volume of what's injected. So overall, most of the time I'm injecting 70 microliters, so that's 0.07 mLs, right? So it's a very small amount in a very short period of time. Again, so imagine 0.07 mLs going in at 150 meters per second. So it's very, very quick. Basically, every injection treatment is, I tell everyone, okay, so when I do your injection, the needle goes in, then I push the material, then the needle comes out. Instead for here, it is as fast or faster as I put the needle in, right? And so patients it is over before they know it, each and every one. So it really is just a wonderful thing. That trauma, when it happens, induces those fibroblasts, induces that collagen and elastin that we'll talk about more in the various phases of healing. So that's really nice. As well, this is a very safe procedure. So I don't worry about vascular occlusion when I'm using filler. Other material, even Carniol, right, has a risk of vascular occlusion. And so I don't stress about this. I don't stress about this device in the hands of me or one of my staff members, because it really is a beautiful, safe device that we can use, and I'll show you lots of different things. So many different treatments. First and foremost, I love using this for scars. Acne scars, this has transformed my practice. It is literally night and day different than how I used to. Traumatic scars, I also love to treat with this. Keloids, we'll talk about really a beautiful treatment in both. Here we'll talk about medicated and non-medicated. Actually, both work beautifully. I do a lot of PRP hair restoration or PRF hair restoration, and I've moved a lot of patients over to the Energet because they like it more. As well, I think it has some extra effects that the standard treatment doesn't have, which is really nice. Also, we'll do some kinetic lifts that we'll talk about as well. So what is this kinetic lift? So basically, we are lifting the tissues. We're lifting the scalp by stimulating and contracting the dahlia above that frontalis. We're stimulating and contracting that temporoparietal fascia, that SMAS tissue layers. And so we do notice that this will induce some changes even pretty far away, which is amazing. So injecting into the hairline here will lift those brows. injecting into the temples will actually cause a little bit of a tail lift, which is just beautiful, without volumizing and without the strain and the risks of injecting into the forehead. As well as we come down into the SMAS, I'm able to lift that malar area, lift those jowls just a little bit in a really nice, elegant way that patients are very happy with. What I've noticed with my kinetic lift patients is that many patients are very scared. There's a subset of patients, right, who are scared of filler. They're scared of that overfilling effect. And what I tell them is, there's nothing going in that cheek. You're not going to look weird. And so there's a certain percentage of those patients that are filler naive and filler scared, and they'll totally use filler for here. So for the kinetic lift, actually, I usually use a combination of both filler and PRP. And I do that actually with many of my treatments. I kind of mix and match. It's one of the most versatile things about Energet is that we're able to mix and match different types of materials with it and able to tailor the treatment. So the Energet is the tool for me to use various medications. Let's talk about dermal thicknessing and necklace lines. So Tectonic, I know a lot of patients see it. It's something that I've struggled with. A great facelift, I think I do a pretty good facelift, doesn't address those Tectonic lines. There's different neck lifts that you can do, different injection treatments, and I've done them, just about all of them. Some of them work okay, some of them are very painful to do. This is a beautiful treatment for getting those necklace lines so much better in a very easy way without the discomfort that it used to take to get a much better result. As well, I have a facelift patient that I did her face, I did a CO2 laser, I've done all these various things, and every time she shows up, she goes, yeah, but look at my chest. And it's because I did her décolleté with the Energet with PRP, and she loves it. She's someone that is a Jersey Shore gal, now in her 60s, has had that sun damage there, but it is really remarkable just how much changes she's had. So scar treatments. This is really the beautiful thing, especially for these acne scars. So I see a lot of patients who have failed CO2 laser with Zone, they've failed microneedling, and it's because when you're doing a scar treatment, you have to get into the scar. There is no way of treating a deep acne scar without getting down in there, right? Because there's a tether, there's a loss of tissue between where that epidermis was lost, where that dermis was lost, where that fat was lost, because of that inflammation, particularly with that cystic acne, that scarring acne that happens. And so what do we need? We need to break up those scar tissue that's deep underneath the tissue. So I used to do this with a needle. For those patients with very extensive facial scarring, it would take me a long time. I'd be sitting there for 45 minutes, an hour. I'd be injecting numbing, doing other numbing in there. It's very tedious. I tell patients that I'm doing surgery, but I'm doing like 30 or 40 different surgeries. And each scar gets its own treatment. Energet, it's amazingly fast and easy for me. So it is, I basically no longer, I'll tell patients about standard subcision and then just go right to Energet. Because I can break up that scar tissue so much faster with the Energet than I can with my needle, without the discomfort. Because literally, it is tough for those patients. They are never quite numb enough when I'm doing that subcision with a needle. But this is beautiful. You get to see immediate lifting. And as well as you guys know who have treated acne scarring, there's some patients who come in and they've had their acne scarring for the last 30 or 40 years. Right? Those are the patients that they know are never getting better. But there are those patients who have active acne still, or in the course of treatment of active acne. Obviously, Accutane is something different, but active acne I can treat. I just won't use filler, right? It's a dirty field. I don't use filler, but I can use PRP. I can use some saline for those patients and feel very comfortable that I'm not going to be inducing scar tissue. I'm not going to, I don't have nodules in my practice from filler because I'm thankfully very safe and conservative with these things. What happens for keloid scars? So keloid scars, as that material goes underneath the skin, there's this vacuolization. It's going to be breaking down the scar tissue, disrupting some of that dense blood supply that's in there, and it's going to ripping those fibers. It's a wonderful treatment, and this is, so many keloids, and I'll show you some hypertrophic scars, are just plain saline, or a little bit of my own special mixture of saline, some lidocaine, some bicarb, but we're really inducing some wonderful changes And then as well, I'll treat those patients with some Carniol as well. So especially for my higher Fitzpatrick types, I actually just try plain saline first, and then I'll move to a Carniol treatment depending on how things are moving. And so there we're able to depot that Carniol deeper into the tissues and induce those changes. Again, I don't worry as much about blood supply. I don't stress as much about hypopigmentation, although to be honest, I always stress about hypopigmentation. So it's not like I stress about everything. But this is really a beautiful treatment. And again, the EnerJet is the tool that I use to get the material in there. And so in my practice, just using that needle into that keloid, it is dense, it doesn't want to go. This breaks up and gives me that softening immediately. Literally, my staff will take a feel of these scars, and you can immediately feel what was a tense, hard keloid is just softer. So what happens? Well, right away you get the Cinderella effect. You get that tissue swelling, that any treatment that you do, right? You have a romantic Saturday night, your lips are a little swollen the next day. Okay, that's a Cinderella effect. Okay, so that little bit of swelling, of course that's gonna go away, right? Literally every single treatment does that, and some more than others. So that's the immediate effect that happens. But then also when I'll use something like PRP or PRF, that'll stick around for a few more days, or hyaluronic acid, that'll stick around for longer. I tend to use long longevity HA fillers, so therefore I do get that nice long effect. However, the FDA approval for these things in terms of longevity, not been proven when you're firing it at 150 meters per second. So I do wonder about its longevity, but the nice thing is that we're also getting these additional growth factors, these additional remodeling that starts to happen. And so even as that filler starts to go away, I know that it's being replaced by good tissue. So histologically, there's vascularization in the dermis. That's the big deal. I think that's breaking up the tissues. You're getting dispersion of material. So as I said earlier, we get to set the amount of material. Typically, I'm injecting around 0.07 milliliters or 70 microliters. And then also you get to set the pressure. So as you can see, at 15% pressure, which is 2.5 atmospheres, right? The bar is basically atmospheres of pressure. You're getting some good depth of about 4 millimeters. And as you go up, typically, I basically never set the device to less than 35, almost never less than 40. And typically I'm going to 50, 60, 70, depending on the tissues to get that good delivery. You're talking about 4 atmospheres of pressure in that very focal area. You are getting that really nice deposition. Histologically, you see collagen, you see glycosaminoglycans. Those are those natural hyaluronic acids too, and fibroblasts. Again, this is all, as we were just talking about, beautiful regenerative medicine. This is without any active medication or with it. The dermal thickening studies, this is actually a really wonderful study. They treated patients for 3 treatments and then looked at them right afterwards. They saw that, of course, they had some dermal thickening. But the really nice thing about this study is that 6 months later, so that's the yellow bar, you can see those patients actually are still doing better than they were right after. So there truly is an ongoing effect with these patients. That's really nice. Keloids as well. Anyone who's treated keloid patients, they always complain of 2 things, pain and itching. That's what brings people in. I mean, they hate the way it looks, but pain and itching are the things that really drive them nuts. And we can see some improvement just in a few days of pain and itching and also softening. So that's really great. They showed a 50% decrease in the scar scale, which is a really nice thing. I want to make sure I get to my photos. In some kinetic facelift patients, again, lifting those brows, you're going to see some visible improvements in the brows and the jowls, which is really nice. And the nasolabial folds, and as you can see, more than 1 millimeter, almost 1.5 millimeters of thickness in that skin. So that's a really nice thing. So big changes, little recovery. So you can see on the far your left that there's that nice mosquito bite, that TB injection effect right away, and then that really starts to fade faster and faster. On the bottom line, you can see one of my really wonderful patients. We did a kinetic lift on him. We did the necklace lines. You can see right after, he looks very interesting. But the nice thing is that 3 hours later, he sent me this picture. So obviously the lighting is from his, I think, bathroom. Those welts are almost entirely gone. And just with those little mosquito bite, those little red dots. He called me, he said, Eric, it looks worse than it is. These are like, I tried to get the most dramatic lighting this way I can actually show you. said, great, thanks, Ruben. But really, really a sweet guy. And then you can see a couple days later, he's pretty passable. This is without any makeup. If he chose to, he just doesn't wear makeup, but if he chose to, he'd be able to cover those up. So this patient was a kinetic lift patient that I did single treatment, and I wanted to see what I'd get out of it. So I did a whole bunch of areas. And there were some interesting effects when I looked at her before and after, so we'll go over these. First thing, I did not mean to change her hairline, but her hairline comes forward about 1 centimeter, which is really elegant. Next thing is I did not expect, and we were nowhere near, the orbit, right? But what you often will see in the aging patient is you'll see what we call an A-frame deformity. So you'll see that hollow within the orbit itself is something very difficult to deal with when we're doing blepharoplasty, and there are various techniques to make it better. But what you can see in the before and after for this patient is that area becomes more full. Why that is probably because she's having to do less work with her frontalis, so she's not pulling up because the brows are naturally at a better state. As well, you can see some nice some nice fullness then in the cheeks and along the jawline. The jawline doesn't show up as well in my lighting in my office, but it really is a nice effect. So take a look at that hairline. Again, this was a filler treatment. This was not a PRP. This was not meant to do a hairline treatment. Take a look in that superior area of the orbit. You can see that's what an older eye looks like. And as that muscle relaxes into there, adds that fullness. Take a look at those cheeks. There you can see it really starts to add in. So it's a really beautiful treatment. She works as close as I do with people, and so she was able to go back to work, the next day. She had a couple little spots. She actually chose not to put on makeup, did not scare her pediatric patients. This patient, a dark skin patient, we did a necklace lines. For her, she's just got that tan that never goes away. So even in the after photo, you can see after a single treatment, she still has that darker pigmentation. But she as well, I did her neck liposuction, and still had these tech neck lines. And now every time I see her, she goes, I love my neck, I love my neck. And I go, great, it's the chin I really want you the most happy with. But that's okay. The necklace line is really just a nice, elegant treatment. This is a patient we did for hypertrophic scarring. He actually had muscular implants all over his body. I'll show you some more pictures. So here we did 3 treatments. Unfortunately, he liked to scratch some of his scars, just as he's a little bit of an anxious guy. And so that's that area that you can see a little bit wider. But you see this scar is 6 months old to start with, so it's not going anywhere at this point. You can really see a nice treatment. For most of his scars, though, the first time I saw him, I said, I'm going to treat you, I'm not going to charge you, but I'm just going to do the right half of every scar. And so literally my staff said, okay, well, I made sure we write it down, made sure when we turn the patient over, I continue to do the right side and not the left side, don't get confused. And what you can see is a single treatment. This is a non-active medication. This is just a saline treatment. You can see that scar basically vanishes at session 1. Again, this is 1 month later. This is not Carniol, this is just saline. So the Energet really went in there, broke up that tissue in a really beautiful way. Eventually, he said, great, half the scar is better. Can you do the other half now? So yes, that's how I got the other one to show that it's great. And as well, I was able to start this patient myself, do the first treatment, and then hand it off to my staff. So again, a very delegatable task that we were able to make some really nice improvements. Microneedling was never going to get into those deep scars. And as those of us know, microneedling is a very poorly understood thing at what depth everyone should go, right? And so at proper depths, you're never going to get the right treatment. At a significant riskier treatment, potentially you could get something, but this is just unheard of. So you're just not going to get there. Some other studies by some other physicians. This was a single treatment looking at mid-face and lower face, so you can see some really nice improvement in those fine lines. In this patient, very severe scarring. This surgeon had used a combination of 5-FU, 5-fluorouracil, and some steroids. You can see a really nice improvement after a single treatment 14 months later. So again, a really nice improvement. And again, it's about using the Energet in different ways. So some thoughts, Yes, it's a noisy machine. When the first time you always kind of shoot it off next to the patient, they get used to it very quick because it is a pneumatic device. Literally after the second shot, they go, okay, I get the sound. Then you put it on them, and the first one, they go, I'm going to hit you with this. And then after the first one, especially I have a lot of 18-year-old men with early hair loss. They get the first one, then they get the drill, they move on. The effects improve over time. I do this as a single treatment, a series, or multimodalities. So for a lot of my acne scar patients, I'll start them with Energet, move them to microneedling because I can get those deep scars very shallow very quickly, and then turn them over. So that's a pretty standard thing. As well, bruising's pretty minimal as we go, and there is a learning curve. I get to play with the different materials. I get to learn what is going to work in this patient or not, and different scars I can treat differently. So really, Energet is a needle-free treatment with real results. It's a beautiful treatment in that it's really fast. It's much less painful than the others. I never say pain-free. I feel like that's just a lie. But it's just nothing's really pain-free in life. But it really is a safe procedure as well that I can hand off to my staff, which is just wonderful. And there's no question in my office. We have more things that we want to do with it, more ways to play with it. And so we really want to see exactly what this thing can do in ways that I think Sinclair and Andrew will be excited about. So thank you very much for having me.